gives me great pleasure to introduce Dr. Aimee Sisson. Dr. Sisson is our Yolo County Public Health Officer who joined the County Health Department in September of 2020. She came to us from a previous post as Public Health Officer in Placer County. She's a graduate of UC Davis and previously ran a small urban farm in West Sacramento. Currently holds an appointment as Assistant Professor at UCD's School of Public Health, where she teaches graduate students. And this evening, we've asked her to share her perception of Yolo County's health and well-being from a public health perspective, especially as it relates to health equity. We'd like to know what she sees as the major challenges for the county and the county health officer, and her priorities for Yolo County public health programming for 21-22, and how the Davis Area League of Women Voters can support her vision. After her presentation, we'll have a brief Q&A. So if people want to submit questions, please do so using the chat function. We'll try to get to as many as we can. And with that, take it away, Dr. Sisson.
Well, thank you, Michelle, for that introduction, and thank you to the group for the opportunity to present this evening. I will apologize from the start that you've stretched me with this presentation. Michelle has added a month to my tenure, almost 2 months to my tenure as Yolo County Health Officer, so I didn't join until the end of October, and nearly everything that I've worked on so far has been COVID-19. So I'm appreciative of the opportunity to prepare for this talk and to talk to you about things that are bigger than COVID, but also recognize that I'm a little bit rusty on some of these topics because my brain has been 99.9% COVID for these last several months. And also just to say that I'm new to the county, so my perspective on what the biggest health challenges are here is not the most informed at this point. I'm learning as I go, but I think many of you have great insights, and there is an opportunity that's now available for all of you to get involved in a new health assessment process that just went live. So I'm going to talk about that a little bit. So without further ado, I'll go ahead and jump into my slides. And I think we can move on to the next one. And I think Michelle already introduced the topics that I'm going to cover. So we'll go ahead and start with the first topic, which is county health status. And I think if we're going to talk about the health status of Yolo County, we first have to talk about what do we even mean when we use the word health. And I want to start with the World Health Organization definition of what is health. And the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So it's a very holistic definition of health that takes into account more than physical health, and it also includes things that we might often talk about as wellness and not necessarily and health promotion, and moving away just from talking about disease. So that being said, a lot of the things that we use in public health to measure health are actually measures of the absence of health, which is disease. So it's sort of ironic that to measure health, we're actually measuring disease. And there's a lot of different ways that we can measure disease. We talk about morbidity, which is how much illness there is in a population, and we talk about mortality, which is how much death there is. And then there's also a lot of ways that we can compare levels of disease. So we can look at the rate of disease or the number of cases this year compared to previous years. We can also compare Yolo County to other counties or to state or national or international averages. And then we can also look at and measure health relative to an established standard, like the Healthy People 2020 guidelines, where they've set target metrics where they want every jurisdiction to reach. So just noting that this concept of health status is and can be rather complicated, and there are many reports on the status of Yolo County's health, and we're continually generating reports both at the state level, the county level, and other entities. And obviously we're not going to cover all of that content in this 30-minute talk. Next slide. Yeah, so one report that comes out on an annual basis from the California Department of Public Health are the county health status profiles. And this annual report tracks 37 indicators, but it uses data that's a couple years old. So this is not breaking news type of data. So the 2021 report uses data from 2017 to 2019, and it compares 2017 to 2019 to the previous 3-year period in most cases, which was 2014 to 2016. Of the 37 indicators that are tracked in this report, in 2021, Yolo County was doing better than the state average for 24 of those indicators. So on the whole, we're a pretty healthy county. We were exactly at the state average for one indicator and below average for 12. So again, we're on the healthier side of things as counties relative to other counties in California. Again, if we were to talk about standardized results, where there's a target to be met, there are 28 indicators in this report that have a target value, and Yolo County met 18 of those. So again, we have a passing grade. Some of the areas that jump out at me in reviewing the report are significant increases in sexually transmitted disease in this latest 3-year period compared to the previous 3-year period. So HIV and AIDS, gonorrhea, chlamydia, and syphilis rates were all increased. And we'll talk more about that later in the priorities. And we also rank very poorly when it comes to Alzheimer's disease deaths. We're 55 out of 58 counties. So that's our worst overall ranking for any of these 37 indicators. So the other, one of many other ways of measuring the county's health status is a community health assessment process. The Yolo County Health Department pursued and received accreditation several years ago, and as part of the accreditation process, we undertook a community health assessment, which then turned into, or was the basis of a community health improvement plan. That process took place in 2013 to 2014 and identified 3 priority areas, and then those were the basis of the improvement plan. So there are detailed work plans related to mental health, chronic disease prevention, and healthy aging. The community health improvement plan that was put together back in 2013 and 2014, and there's a picture of it here, and I've linked to, or I'm sorry, I guess it's not a link, but it is the website of that plan at the bottom of the slide, was for 2015 to 2020. We're now in 2021, so it's time to do this again. And it's a 3-year cycle to create the next community health needs assessment and community health assessment. We're collaborating with multiple entities and putting this together, including the nonprofit or the hospitals and health systems participate in this. And we're community health status survey that is open to every resident of Yolo County to participate and let us know what you think the important health issues are for Yolo County. And so I've included links on this slide to the survey. It comes in 3 different languages. So there's an English, a Spanish, and a Russian version. And we'd appreciate all of you who are interested participating in the survey and also helping us get the word out about participating in the survey. And I believe a press release just went out, so there's additional information that's available about this survey, but please do participate in this next process. This is where you are going to help us come up with what the biggest health concerns are in Yolo County, identifying them through this needs assessment process, and then working together to come up with a plan, a community health improvement plan to address the challenges that are identified. Next slide.
I'm so sorry. I don't know. Oh, there we go.
Okay, so I want to transition to the next topic, which is talking about health equity. And I think before we launch into details about health equity, it's useful to have some shared definitions of what we mean when we're talking about health equity. And so I've pulled a couple of definitions from the Centers for Disease Control website. And the first one, and I apologize for the wordy slide, I don't usually do this, but I thought this was the simplest way to convey this information. Health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. And health inequities are reflected in differences in length of life, quality of life, rates of disease, disability, and death, severity of disease, and access to treatment. And we're going to talk in some upcoming slides about different ways we can measure health equity or lack thereof, as well as some of the sort of underlying factors for health equity. And that's, I know Brian Vaughn, our public health director, has presented previously to this group about health equity and social determinants of health. So I don't want to spend a lot of time here, but I want to make sure that if I'm using terminology that we're all starting from the same place. So this concept of social determinants of health, or the conditions in which we are born, live, work, play, worship, and age, have a profound impact on our health. So basically where we live and the resources that are available, the opportunities available to us to determine the types of decisions we can make, whether they're health promoting or deleterious to our health. And that underlying differences in social determinants of health contribute to health disparities and health inequities. And I think I like this last line about public health crises may focus attention on disparities, but inequities have been around for a long time. So we talk a lot during COVID about health disparities and inequities. And they're not new. COVID brought a lot of them to the surface, but the underlying determinants of health and the environments that create those disparities have been around for a long time. And we're going to talk a little bit more about that moving forward. So next slide, please. There are several sets of pictures that talk about equity and versus equality and inequality and justice. This is my new favorite set of these slides. There's another set of slides that show people standing behind a fence trying to watch a baseball game. And I've moved away from those slides because it suggests that there's inherently something different in the people who are watching that baseball game. There's a shorter person and a taller person. And really, this isn't about underlying genetic differences. This is about taking, two human beings who live in very different sets of circumstances, and that's why they have different health outcomes. It's not because there's anything fundamentally different about those human beings. So that's why I like these tree slides. And so as you move from top to bottom and left to right, we see inequality and then equality, where everyone has the same ladder, but they're still not able to achieve the same outcome or reach the fruit. So equity is when you tailor your intervention and you have different size ladders so that the ladder allows somebody to reach the fruit. And then of course, justice is when you straighten out the tree so that everybody has access with the same ladder. So I really like this picture. I think it's helpful for talking not just about health equity, but just about equity in general. And I think there's been a lot of that discourse happening over the last couple of years. Next slide. So a couple other pictures I want to share. When I worked at the California Department of Public Health, prior to my work at Placer County as the health officer, I was part of the Health and All Policies Task Force. And a lot of what we did was talking about what makes a healthy community. And it really is about the underlying determinants of health. And so we need communities where environments support health, where they meet the basic needs of all in terms of transportation, housing, access to safe and affordable and healthy food, clean water, access to healthcare, which is just one small piece of determinants of health. Also thinking about the environment in terms of air and water quality, but also economic and social development. and social relationships that are supportive and respectful. So I think this list is very helpful as you're thinking about, well, what are the determinants of health? It can often be a very jargony phrase. So this really gets at concrete aspects of a community to think about. And if you want to improve the health of a community, these are some things to target. And then the picture on the right-hand side of this slide was put together by a group in Fresno County when they were trying to envision what a healthy community for children in the Central Valley would look like. What I think is very interesting is that this picture aligns so well with the items that are noted on the left-hand side of the slide. And I've done an exercise with groups across the state of many different age and education levels, ranging from high school to medical students and public health students and the general public. And no matter what group you do this activity with, when you ask people to think about what is a healthy community, they almost always come up with the same list of things. So, and that's the list on the left, or what's shown in the picture on the right. So we inherently understand the things that we need in our communities to make us healthy, yet sometimes we lose sight of that big picture and focus on healthcare and access to healthcare, and that's just one small piece of creating a healthy community. Next slide. So this is a very common slide that Brian probably shared with you when he presented, but again, understanding the context of determinants of health and how they shape. So the determinants of health are primarily summed up in the living conditions in the center of the slide, and how those living conditions then shape risk behaviors made by individuals, which then lead to disease and injury and ultimately cause death. And we move from left to right. We're moving downstream, and as we move from right to left on this slide, we're moving upstream. So oftentimes in public health, we talk about the need to shift our focus upstream away from more traditional public health practices that are focused on what's killing people, what's making people sick in terms of immediate causes of death, and looking further back and saying, what are the conditions in which people are living and how are those influencing their health or lack of health. So I'm going to talk later about needing to move upstream, and that's what I mean is going to the left-hand side of the slide and addressing root causes. And Michelle mentioned that I farmed in West Sacramento for a few years. The name of my farm was Root Cause Farm. It was intended to address the fact that I was growing plants that have roots, but also food and healthy food and access to healthy, affordable food is a root cause of many chronic diseases. So addressing root causes is near and dear to my heart on a lot of levels. Next slide. So I've talked a lot in theory about health equity. I want to talk about how we can actually measure health equity. And one of the frameworks that we've talked a lot about in terms of health equity during COVID is the Healthy Places Index. So this is a screenshot of the Healthy Places Index for Yolo County. This is all publicly available. Just Google Healthy Places Index and then click on the map tab, and then you can sort or search by county. So you can see Yolo County outlined in sort of the bold black in the middle. And unfortunately, this is a little bit blurry, but the percentile of the Healthy Places Index, which is a composite index of 25 indicators that groups together multiple social determinants of health across the categories that are listed here: economy, education, transportation, social environment, the neighborhood characteristics, the cleanliness of the environment, housing availability, and access to healthcare. And those are all, those individual indicators within those categories are ranked. A percentile assigned to each of them, and then you get a composite score for every census tract in the county. So that's what's shown here, and then the percentiles are for the entire state, and healthier or communities that have healthier conditions are in darker green, and then less healthy as you move towards darker blue. So where you see green, that's good. You see a lot of green in the Davis area, although there's one blue census tract that we're going to talk about a little bit more, and then a fair amount of blue as we move into West Sacramento, but also some parts of Woodland in our unincorporated areas. So this allows us at a glance to see that there's different areas of Yolo County where the conditions, the social, environmental, and economic conditions are more or less supportive of health. So let's zoom in a little bit on this way of measuring health equity geographically. So let's look at a census tract in Davis. So next slide. Sorry, go back one. So geographically, just so you can see where we are, we've got the university campus in gray on the left, and then we're looking south of the interstate at the census tract in blue. And I apologize that the picture is not as clear as it was on my screen, but this is census tract 106.08. And go ahead and move to the next slide. So within this census tract, there are 4 areas where the scores are not great, and that's what brings this census tract down in terms of its the healthfulness of the community. So there is a large amount of poverty in this neighborhood, a lot of unemployment, and in general low median household incomes. We also see when you move to the housing category in the second column there, that there's a severe housing cost burden for low-income renters. So a lack of affordable housing. Also throughout Davis, we see low scores for the cleanliness of the drinking water. And then finally, for social in the column on the right, we don't see a lot of civic engagement with less than half of the population of the census tract voting. So just wanted to point out one particular community in Davis that has a lower percentile score. Again, that overall percentile score was 43.7 for this particular census tract. Next slide. We'll quickly take a peek at another census tract in West Sacramento. If you could go back 2 slides. So we're talking about this dark blue census tract in the middle of the screen along West Capitol Avenue, right on both sides of the 80 freeway. This particular census tract, 102.03 in West Sacramento, has the lowest percentile score in the Healthy Places Index in Yolo County, 3.4. Basically the 3rd percentile. So it's only doing better in terms of the healthfulness of the environment than 3% of census tracts across the state. And so there are very few categories in which this particular census tract scores well. Next slide, please. You can see some of the characteristics of particular concern in this census tract: a lot of poverty, lack of employment, low incomes, low education, no access to cars, virtually no civic engagement, few 2-parent households, nearly all adults are lacking in health insurance, and housing is not particularly affordable or habitable. So a lot of concerns with this particular area of West Sacramento. So definitely not a neighborhood that's conducive to healthy people. And if we want to improve the health status of people in this particular census tract, then we need to invest and address the underlying determinants of health that are really framed out nicely in the individual scales and metrics of the Healthy Places Index. So that's one way of measuring health equity from a geographic and index-based perspective. Next slide, please. Here's another way where instead of looking at predictors of health outcomes, so none of those metrics in the last few slides for the Healthy Places Index were actually measures of disease. That was all determinants of health. So we can also look at health equity from a disease perspective. Where are people getting sick? So this is a geographic approach to health equity using COVID-19 data. And this just looks at recent cases for June 15th to July 15th, so over the last month. And we've color-coded them by daily case rate per 100,000 residents. So it's color-coded per the blueprint metrics. So the more cases there, the highest rate is the purple tier, which is 10 or more cases per day. And then we have red, which is 6 to 10, yellow, which is 2 to 5.9, and then, I'm sorry, orange, and then yellow, which is 0 to 2. So what's interesting when you look at this is we have census tracts in Yolo County that if they were counties and if we were still following the blueprint framework, they would be in the purple tier. And then we have areas of Yolo County that would be in the yellow tier. So we are seeing disproportionate impacts in certain census tracts by COVID-19. And while this is looking at data for a particular health outcome, if we were to look at the predictors and the determinants of health, we would see that there's, in many cases, a linkage between those determinants of health and so areas with lower Healthy Places Index scores often correspond to areas with higher COVID cases. But that's not shown on this map, but that's something we've seen over the course of the pandemic. Next slide. And I'm sorry, these are not coming through. They look great on my screen, but we'll make sure that the original slides get sent out to you so you can see them in higher resolution. But this is state data, so I don't have the racial and ethnic data for COVID-19 at the county level at at my fingertips. But what you can see about halfway down on the left, so this is looking at cases of COVID-19 throughout the pandemic by race and ethnicity. And the sort of dark blue bar represents the proportion of the population that the proportion of the population, and then the light blue is how many cases there are. So if the light blue extends beyond that sort of blue hash, that means a population has been disproportionately impacted. And we certainly see that profoundly for the Latino community, both in terms of cases on the left as well as deaths on the right. So seeing disproportionate impacts by race and ethnicity. So I include this slide because we're looking, it's a different way of measuring health equity. It's based on race and ethnicity. We can also do it by age, by gender, compared to the previous slides, which were really based on geography. Next slide. Okay, so I'm going to shift away from talking about health status, and I want to talk about some of the challenges that I see as the Yolo County Health Officer kind of over the short term. And when I originally agreed to do this talk over a month ago, I think we were either still under the blueprint framework, we hadn't reopened, or we were just starting reopening, and everyone was very hopeful that we were moving beyond COVID and that this was going to be a talk not about COVID. And yet here we are with cases increasing and the pandemic still very much not over, particularly for those who are unvaccinated, but it's still an issue for even those who are vaccinated. So, you know, the biggest challenge right now continues to be getting through the COVID pandemic, which has been very challenging. And then, you know, as I started thinking about all the other challenges that we face in terms of health in Yolo County, so many of them are related to the COVID pandemic. There are things that have increased because of and during the pandemic, hard necessarily to be sure that things are causal. Sometimes things are just correlated. But we've seen a lot of other diseases increase during the pandemic, in a lot of cases because there's been delayed or limited access to care. So I'm going to kind of talk through all of these other diseases that are on the rise because of COVID-19, and then talk a little bit about burnout in our public health workforce. And then of course, I don't think any talk about major public health challenges anywhere in California, the United States, or the world would be complete without talking about the significant health impacts of climate change. Let's just quickly go through these next few slides. I just want to go through each of these in turn. So the COVID-19 pandemic isn't over yet. This slide shows cases from the very beginning in March 2020 when Yolo County had its first case through today. And when we look at the big picture compared to this giant lump of cases in the middle of the screen, which is our fall and winter surge, what we're seeing right now are relatively minor increases, but we have quadrupled our case rate in the last month and a half. But it's helpful to see this big picture that compared to where we were in the fall and winter, things still look really good, but we're also on the beginning of the curve, and it's hard to know exactly where we'll land. So COVID continues to be the biggest health challenge that we're facing in Yolo County right now. Next slide. But I also want to talk about the increase in STDs that we've seen in Yolo County. So next slide, please. Oh boy. Okay. So at least part of this is clear. You can see an update that came out from the CDC in terms of STDs in April of this year, showing that data only through 2019 showed that STDs, nearly every STD, had increased for 6 years in a row. And the text on the right that you can't read shows that doesn't even include the impacts of the pandemic on STDs. And we've seen in Yolo County, we just don't have any official figures right now, but continued increases in nearly every sexually transmitted disease during COVID. Oftentimes, particularly amongst the sexually transmitted diseases that may be asymptomatic, that we're not necessarily getting people screened, and so in some cases the testing is less than it should be. So even though we're seeing increases, we're probably seeing a lot less than is really out there. And then of course we're seeing spread because people aren't getting tested and therefore they're not getting treated. Next slide. Another aftermath of COVID challenge is opioid overdoses. So next slide. We've had an opioid epidemic and crisis in California for a number of years now, and Yolo County has not been immune from that. Unfortunately, during the pandemic, we've seen an increase across California and across the United States in opioid overdose deaths. Some of that is from contamination of the supply with fentanyl, which is a very potent synthetic opioid, and then some of it is reduced access to care. Many of the inpatient treatment programs either closed or were very restrictive because of COVID precautions, and so a lot of people weren't able to access care and may have relapsed. In addition to people having significant new stressors in their life because of the pandemic. So another concern that we continue to face is opioids and opioid overdoses. Next slide. I want to talk a little bit about adolescent mental health in terms of suicide and suicide attempts. We've unfortunately seen suicide attempts as well as completed suicides in Yolo County over the last year in our teenage population. Next slide, please. So unfortunately, you can't read this either, but there's a Morbidity and Mortality Weekly Report, or MMWR, article about emergency department visits for suicide attempts among teenagers across the United States, and what they showed that particularly among girls during the last summer compared to the summer previously, that suicide attempts had increased by 50% amongst teenage girls compared to the previous year. So very concerned there. Next slide. Okay, next, so we're going to talk a little bit about another problem that has gotten worse and we expect to get worse because of COVID, which is obesity and obesity-related chronic diseases. Next slide. So you've heard of COVID-19, the disease, but are you aware of the COVID-19, the 19-pound weight gain? It actually, this study showed that the average weight gain was closer to 29 pounds in about 40% of the population that were surveyed by the American Psychology Association. So this is a problem. We already had an obesity epidemic, so we're seeing even more adults who have gained weight because of COVID. And in turn, we expect to see increases in heart disease as well as diabetes and other obesity-related chronic illnesses. So this one will continue to be a problem for years to come. Next slide. Okay, vaccine preventable diseases. Unfortunately, because a lot of people were not seeking regular health care during COVID, and a lot of visits were done remotely over the phone, which was great, but you cannot give a vaccine to somebody over the phone. It requires an in-person visit. So we have a lot of kids and adults alike who are behind on their routine immunizations. And so we do run the risk of seeing increases in vaccine preventable diseases because people have not gotten their routine immunization. So we have an opportunity with the return to in-person school this year to get kids caught up. I also am encouraging adults to see their regular provider to get caught up, but we've seen declines in nearly all compliance with vaccines. So we have some work to do to get people caught up on routine immunizations, just as we have work to do to get more people vaccinated against COVID-19. Next slide. I also want to talk about other things that we've delayed, screening to prevent cancer. So things like pap smears and mammograms that help us detect cancers that could be potentially deadly at an earlier stage. So this is a piece from the CDC newsroom, a press release talking about delays in mammograms and cervical cancer screening, and how that potentially could lead to diagnosing people later where they're less likely to be curable. So we need to encourage women and men to get in. So I didn't talk about colorectal cancer and colonoscopies, but there are many cancer screening exams that can only be done in person. And so getting people caught up on these according to the recommended schedules will also be important moving forward, so we don't have an epidemic of cancer following our pandemic of COVID. Next slide. Okay, just two more here. I want to talk about the public health workforce that has been working so hard for nearly 18 months now on this pandemic. We've expanded the public health workforce greatly, but especially in the beginning, we were very short-staffed, and we're starting to experience that again as everyone's trying to return to normal, and a lot of county staff are returning to their day jobs, but yet cases are increasing, and so we're seeing the baseline staff overtaxed again. And this is another MMWR article that looked at symptoms of mental health or mental illness, so depression, anxiety, PTSD, and suicidal ideation amongst public health workers across the United States. And what, again, you unfortunately can't read is that I'll pull it up on my screen here. Amongst 26,000 public health employees who were surveyed nationwide, 53% reported symptoms of at least one mental health condition in the last 2 weeks. So we're looking at a workforce that is really challenged right now, to the point of burnout, and in some cases even thoughts of suicide. So if we want to sustain this workforce moving forward, we really need to invest in their mental health and well-being. Next slide. So the last one is related to climate change. So again, nothing, I finally have something that's not COVID related. So I just wanted to prove that I can talk about things besides COVID. One of the biggest one of the biggest crises facing public health is climate change. And we can see that in the very short term, just looking at climate related disasters in California in the last year. So, you know, this summer with an unprecedented heat, last year with wildfires, the ongoing drought in the West, which of course contributes to the wildfires. All of these have tremendous public health implications in terms of, you know, direct deaths from heat, particularly when we have high nighttime temperatures and we don't get the overnight cooling. Also, you know, people dying in wildfires, and then of course with drought, really with California generating so much agricultural product, how are we going to feed ourselves in the longer term if we cannot grow food here? So just want to keep in mind that while this isn't often in the forefront of people's minds, I think it's becoming more so because of these acute disasters that we're experiencing as a link to climate change. Okay, so that's what I see as our challenges, just a few in the year ahead to address. And then I want to talk a little bit about priorities for this next fiscal year of 2021, 2022. You know, the first one here, and I'm not sure these are in a particular order, and I could certainly come up with more, but I feel like if everything is a priority, then nothing is a priority. So I try to keep this list short. But thinking about our public health workforce, both in terms of their mental health and well-being, because we have so much burnout, but also just from an infrastructure perspective, public health is often subject to a feast or famine funding cycle. And so we are often bare bones where we don't have enough staff to get the work done, and we're having to prioritize to where we are right now, which is we have so much money coming in over the next 2 years that's tied to COVID, but then the potential of that money disappearing and us being, you know, back to our bare bones, not able to maintain a minimum workforce to manage communicable disease like STDs and TB, but also to think about mental health as well as chronic disease. So the good news is that the legislature, after a lot of pushing by local health departments and advocates, after an initial resistance to including a budget item for ongoing public health funding, did settle on a $200 million annual sustained funding for local public health. It's not in this year's budget, but it's been promised in future budgets. So this would help health departments maintain minimal or more than minimal staffing so that we can adequately address disease and also prepare for the next pandemic, which will inevitably come. And hopefully we won't be short-staffed this next time. So sort of the ask here is for all of you to keep an eye on the budgets over the next few years and make sure that that $200 million that's been promised for local public health infrastructure is indeed granted. It's not in this year's budget because, like I said, we have lots of money right now for COVID coming from all directions, but we will need this very soon when the COVID money dries up. So please hold the legislature accountable here. The next item that's a priority is the American Response Plan. That's just the American Rescue Plan. This is COVID money coming from the federal government. Millions of dollars, I think 40 plus million, actually no, that's not the right number. Million, I'm just gonna stay away from a number. Millions of dollars coming into Yolo County, the county itself, and then also millions of dollars coming into our individual city jurisdictions, as well as the County Office of Education. So we have this once in a lifetime really opportunity to direct this funding where it can have the biggest impact. And so going back to that slide from the Bay Area or Bar High, where we show upstream and downstream and thinking about social determinants of health, we have a real opportunity here for a rare opportunity to invest in prevention. So often we're focused on disease and intervening downstream, and we have a big chunk of money where we can invest upstream in things that are going to prevent illness. And so any advocacy to help steer decision makers at the local level, so this isn't just Yolo County, but this is also in city governments, to direct these funds upstream where they can have a positive impact on determinants of health would be very much appreciated if our goal is to improve the health status of Yolo County residents. And then finally, because I love health in all policies and because health in all policies is a piece of the Yolo County strategic plan adopted at the county level, not just within our health and human services agency. So it's a real coup that we have the entire county government thinking about health in all policies. But one of the ways to operationalize health in all policies is every time a policy comes up as a proposal to consciously think about how that proposal is going to impact health and health equity. So that's something I'd like to see get institutionalized moving forward. And so I think advocacy and reminders to everybody that this is part of the county's strategic plan and something that we want to see get operationalized. So it's not just, you know, words on a page, but it's really something that we actively think about and incorporate into every decision that's being made, because these determinants of health aren't just in traditional health areas. So we think about transportation, it's related to land use, which impacts health. It's about agriculture and food and how that impacts health. So policies in what we would traditionally think of as non-health areas have significant impacts on health. And so it's important to consider those health impacts when the policies are being considered. So we invite any members of the public to speak to the board and any city councils about proposals and how they might impact health. So I'm going to stop there. I know I went over by a few minutes, but I think we still have lots of time for questions and answers. And hopefully, Kamal, you can send out the slides maybe as a PDF to everybody where hopefully the images won't be blurred.
I will.
It's very good.
Thank you so much, Dr. Sisson. You certainly gave us quite the tour through the county with that, and I really do appreciate how comprehensive your overview was. I want to say that we've been thrilled to partner with the Office of Elections to help in terms of voter education, and I think we're an agency that's very interested in educating the voters about the issues that are in front of the county, and would be happy to see how we could do that related to health in the future. I want to go through some of the questions. I'll start with one of the last ones we received, and it was sort of specific to something you mentioned about the county's bringing in care for rural communities. And that question was, does Yolo County have a fleet of mobile units to bring more comprehensive testing? I presume that relates to COVID, and care to isolated rural communities.
Yeah, so I'm actually going to combine that question with the next question, which is, does the county plan to continue its partnership with Healthy Davis Together, and could it become Healthy Yolo Together? So I'm combining these because they're related. So they're actually, Healthy Davis Together in some instances brands itself as Healthy Yolo Together. And one of the, there's sort of two instances where that happens. One is in testing and the other is in vaccinations. So we see Healthy Davis Together partnering with the county and with the individual public school districts in Yolo County to offer testing. So they started with Davis Joint Unified School District, and now HDT will be partnering with, I think, every school district in Yolo County for this next academic year to offer testing. So when they're doing that work really focused outside of the city of Davis, they brand themselves as Healthy Yolo Together. And I'm really grateful that for our collaboration with Healthy Davis Together, and for their recognition that Davis is not an island, and that what happens in the rest of Yolo County impacts Davis. And so we're really grateful for the generosity of their anonymous donors and for their willingness to think bigger and look bigger, look more broadly than the city of Davis. So there's also efforts to vaccinate beyond the city of Davis, and Healthy Davis Together has been running vaccine clinics along with Yolo County sort of in parallel across the county. And one of the efforts that we've been talking a lot about with Healthy Davis Together is, can we identify particularly rural areas where we're seeing elevated case rates and send out a mobile team that could offer testing as well as vaccination in those locations. So we're still trying to get that figured out. I know one of the areas, it's not exactly rural, but it ended up being where we had the highest case rates was in the city of Woodland. And so they're adding a community testing location at another, or opening a community testing location to the public that was already happening at a school, and offering vaccinations there as well. So that, I hope, answers the question about trying to get mobile teams out into our more rural communities. The other thing I want to say is right now, until the end of August, the county has our vaccine to order program for COVID vaccines. And so anyone who lives anywhere in Yolo County, including our rural areas, just needs to call the county. We now have an English phone number, a Spanish phone number, and soon a Russian phone number. So people can call and speak to someone in their native language to schedule an appointment. We will come to them wherever they are in Yolo County between the hours of 9 a.m. and 7 p.m., 7 days a week for free to deliver a vaccine. So we don't have testing as part of that program, but we do have vaccination. And vaccination really is the best way forward in the context of the Delta variant.
One of the indicators that you talked about in terms of health was civic engagement. And the question was, how is civic engagement measured? And the thought was that, is this based on the percent of vote, or do you know if there are other measures that are included in that?
Yeah, I think it's, as John pointed out, voting, but I'd have to dig. The beauty of the Healthy Places Index is that it's publicly available and it's quite transparent about what the individual indicators are and what their data sources are. There are 25 different indicators, so I have not memorized them, unfortunately, but I'd be happy to look after this call and get back with you about it. But I'm pretty confident that it's just measuring the proportion of people that voted in recent elections.
Yes, and I have one other question here that I think you could speak to about how the vaccines were rolled out and some of the things that the state sort of dictated a little bit. The question is, California has a $50 billion ag industry. Why were vaccines for COVID-19 delayed for frontline farm workers? And maybe you could talk a little bit about California's Department of Public Health decisions.
Yeah, I mean, it almost feels like another lifetime when the problem that we had was not enough vaccine, and we had to prioritize who received vaccine based on their risk of bad outcomes if they were to contract COVID. So, so part of that was the prioritization was based on risk of death, and then also the challenge was that we were required as counties to follow a very rigid framework that came out from the California Department of Public Health of the order that we had to go in terms of offering vaccinations. And so we couldn't move to one group until we had offered vaccines to everybody in the previous group. So I think Yolo County actually did a really good job in getting the vaccine rolled out to our ag workers. And that was because we had a collaboration of volunteers as well as the Farm Bureau, a group of really committed folks who spent many hours reaching out to farm employers, ag employers, finding out how many employees they had, how many were interested in getting vaccinated, and then scheduling vaccine clinics at those farms and agricultural locations. So we went to them during working hours to make vaccine as easy as possible. So we really, I think, did a good job here in Yolo County. The last number I saw was that 83% of ag workers in Yolo County had been vaccinated. And that was, at a time when we had fewer than that in really any one age group or other population vaccinated. And that was because there were such concerted efforts to get this group vaccinated, because they had been disproportionately impacted in terms of cases because they were frontline workers and weren't able to work from home.
And another question, some of the most recent data about the demographics of who is getting vaccinated showed that the 30 to 34-year-old group was the lowest demographic of vaccinated individuals. Is that still the case? And if so, is there a plan to outreach to this demographic?
Yeah, it is still the case that 30 to 34-year-olds are the least vaccinated age group. I was trying to pull up the latest data I have for this week, and it shows that 30 to 34-year-olds are 30% of them are fully vaccinated, and that is our absolute lowest age group. Even 12 to 15-year-olds are 40% vaccinated, so fully vaccinated. So it lags really by 10 points behind any other age group. We don't have a great sense as to why this is happening, but we are partnering with a media group on messaging that will target this particular age group. And within this age group, we're targeting Latinos in Woodland and West Sacramento, because those are the 30 to 34-year-olds are the least vaccinated, Latino are the least vaccinated racial and ethnic group, and then Woodland and West Sacramento are our least vaccinated communities. So that's why we're putting all three of those together in this new marketing effort. But it would certainly be easier to target this population if we had a better understanding of why they're resistant to the vaccine, and that's one piece that we haven't really cracked that nut. I've heard speculation that it might be related to misinformation around fertility, as well as ongoing safety concerns, but we don't really know, and that's part of what makes it really challenging, is to solve a problem when you don't fully understand the problem.
Well, I think that sort of wraps it up for the questions that we've received this evening. And I really appreciate all of the information that you shared. With your permission, we'll post the recording of your presentation. And if you have thoughts for the future of how the League can be helpful in terms of reaching out to voters and educating them about things that come up, particularly around county health issues, we're here, and we're anxious to spread the word and make sure that the voters are aware of those issues that are important to the health of the community. Unless there's other comments from the board, I think we'll kind of do a little bit of a wrap up here. Any closing comments, Dr. Sisson?
No, I just want to say thank you for the opportunity. Thank your group for the work that you do. As a woman voter, I have to say, I think ever since I've been in high school, I've referred to your flyers that come in the mail and your website for guidance on how to vote, because it's challenging. There's so many issues, and so I just really appreciate the work that you all do to help promote civic and thoughtful and educated civic engagement.
Well, we feel very fortunate to have you. We hope you'll stick around Yolo County for a long time. So just in closing, I did want to mention once again that if there are other individuals, members who are interested in considering participation in the healthcare committee, we are delighted at the thought of having some additional members. Currently, we meet every other Wednesday from 7 to 8 p.m. please feel free to email me. That's my email address right there. And you can join our current membership, which I think is about 9 folks now. And we love talking about health policy, about ways to educate voters, and about projects that we can help promote so that individuals can be better informed about what legislation is out there that relates to health policy, and maybe encourage us to get some additional health speakers to educate ourselves and the community of Davis. Mary Jo, can I turn it back to you for any closing comments?
No, but just we really want to thank you all, and thank you for those that have joined us this evening. And the only thing that we can't do with Zoom so easily is we don't know who's on and who isn't unless we take a picture of everybody or whatever. So some way, if you can maybe go in the chat and just put your name in real quickly and let us know who that you came. It would just be helpful to us. If you want to put your email, we'll put you on our mailing list also. So we just really want to thank everybody for being a part of it. I know it's middle of the summer and not a nice way, but I'm sorry we can't do it in person yet. So thank you very much.